Hey, it's good to see all of you. We've got a great program today. They say that kidney disease is a quiet situation, a quiet condition, should I say, right? And that many people have kidney problems and don't even realize it. Now, is that a truth or is that a myth? It's a truth? All right, okay. Well, I'll tell you what, we have Dr. Laura Maursetter here with us today, who's going to straighten us out and let us know about the truth and the myths about kidney disease. So help me to welcome her to the podium. Laura Maursetter.
Well, I didn't know I was going to be in this room with all these famous people. Congratulations, Ed. I'm so happy to be here. So thank you for inviting me. It's always a pleasure to talk to you about the thing I love the most, which is the kidneys. Not many people can say that, but I've spent all of my career focused on that. Once in a while carrying urine around in my pocket. My kids think that's so gross, and I think, oh my gosh, it's the best thing ever. You know, what a way to study things, right? So I have a chance to talk to you a little bit about both kidney health and kidney disease. And so I want to see, from a show of hands, how many people know somebody who has chronic kidney disease? Yeah, look around. That is a lot of folks. And so we have a problem in our country and across the world with chronic kidney disease. So we're going to talk about that a little bit. But first, I thought I would tell you a little bit about what kidneys are, because they are often an innocent bystander in our bodies. So I want you to take your hands, and I want you to put them on the small of your back here. And you feel the bottom of your ribs. That's where your kidneys are located. They hide right under the back, right under your ribs right there. And when you take a deep breath, they peek out from the below and they hug right back in there. And that's where your hands are closest to your kidneys. Yeah.
My new one is up here.
Absolutely. Well, that's amazing. We should cheer for you. That's great that you got a transplant. Yeah. That's wonderful. We'll talk a minute about that a little later. So thanks for sharing that. Now, kidneys do a lot of jobs. One of them is to make urine, and in making urine, what they do is they get rid of the waste products. So you're all here having lunch. Your body is processing that. It's taking what it needs from the nutrition and putting it into your body, but there's some things that are produced that you don't need. Some of that goes into your stool, but some of that goes into your urine, and the kidneys are helpful in deciding that. In addition to that, it balances the fluids in your body. It also controls blood pressure. It manages your blood production, so your anemia. And lastly, it even works to keep your bones healthy. So those kidneys, which you think are just sitting there not doing much other than making urine, are really doing a lot of jobs. And so when things go haywire with them, you can see how many different things could be affected. So I just put a little graphic up here that shows that what happens is the blood goes into the kidney through that red tube. It goes through a filter, and then the blood comes out of the kidney all cleaned up. And that yellow tube is the tube that collects the urine, which eventually you will urinate out. Okay, that's how the kidneys kind of work. So a little bit more, because we're going to share a little bit about the anatomy, so we're going to have a little med school lesson here. When the blood goes into the kidney, that filter is that little ball right there. And you can see that little ball of blood vessels, and that's the workhorse. That does the filtering. But also there's other blood vessels that go around those tubes, and it really balances all the things in your body. And it's an amazing, amazing job. Our kidneys have 1 million of those little filters in each of our kidneys when we start. And as time goes forward, some of them wear out, but usually not enough that they would not live our lifetime just fine. It's whether we have damage to them that causes that to happen. Okay, so how do we keep our kidneys healthy? So one of the things you might have heard is hydration, and I see some good water pitchers on your table. Love that. But how much water should we drink in a day? I don't know. We're all different. If you spend time outside, you need to drink more water because you will sweat more, especially today. If you are a person who is a mouth breather, you will breathe more water out, and that is something that allows us to need more water. So the biggest ticket I have for you is to look at your urine. If it's dark colored or intensely yellow, it probably means you need more water. If it's a light color, then you're probably doing okay. The second thing I would say is staying a healthy weight and getting some exercise. That also impacts your kidneys. And so as little as losing 5 pounds can make an impact in your kidney health. So sometimes that goal seems really big. If you have a lot of weight you'd like to lose, don't look at it like that. A little bit makes a lot of difference. Avoid smoking. Smoking is a bummer for the heart, it's a bummer for the brain, the lungs, and the kidneys. So if we can get rid of smoking, that's really helpful. And then, yeah.
How do smoking mess with your kidneys?
Well, good question. So she's asking, how does smoking mess with your kidneys? And so smoking can raise your blood pressure. It also puts extra toxins in your body that can damage the kidneys. And so it affects the filters in that way. Yeah. And then the last point I have on here is to avoid medicines that can hurt the kidneys. Does anyone know any?
Yes.
What?
Aspirin.
Ooh. Ibuprofen. Yeah, so one thing I want you to hear is that those medicines that are ibuprofen, Aleve, Motrin, all the ones that are the best for arthritis pain are hard on the kidneys. Now, Tylenol is not. That works in a different way. So Tylenol is an okay medicine, but the ibuprofens are ones that, I just want you to be mindful of those and not overuse them.
Some blood pressure medicines. My kidney doctor was telling me some blood pressure medications. Some of these doctors put you on to mess your kidney up too.
So she's mentioning that we have to be careful about some other types of medicines that can be impactful on the kidneys too. And that's one of the reasons why we monitor our kidney function, so we can look for those things that might hurt the kidneys over time. But I want you to see, and you guys showed me already by a show of hands as to how many people know somebody with kidney dysfunction. This is the graphic that tells us in, people over the age of 65, 1 in 4 women and 1 in 5 men. And if you get to 75, it's even more. And so when you start to think about how many people have chronic kidney disease, it sure ends up being quite a lot. And that is something that's monitored routinely on your labs and when you go to see the doctor. But sometimes it's not the biggest issue, so we end up not talking about it all the time. But we're going to teach you today what to look at so you would have an idea as to how to figure that out.
Because you don't want to go on that, because you don't want to go on dialysis.
Yes, I hear you. You have an experience with dialysis. 4 years, yes, it's a big deal. It's a big deal. And what we see is people who have chronic kidney disease often have a shorter lifespan. And that's the reason we want to find that. And if we can prevent that, it helps people live a better life. And so that's what we're here to talk about. So one of the reasons why we don't hear as much about kidneys is something that Janice mentioned. There is often a silence around kidneys. They're one of my favorite organs because they work to their hardest extent until the bitter end. They don't often cause you pain. They often don't show up and have any symptoms until they almost don't work. And so some people have quite a surprise once in a while when they are diagnosed with chronic kidney disease. We don't have something like a heart attack or a cancer diagnosis, and a lot of times people know, that's what happened to me on this particular day. That doesn't happen with the kidneys very often. And I wish, sort of, that we had some type of kidney attack, because that way then people would start to pay attention and be able to know that that's an important aspect to take care of. So one of the things that can happen is that we do lab tests. And I am sure if I ask you who's had a lab test this year, we'll have quite a number. Yes? Kidney doctors love to take lab tests, and the reason is what I just mentioned. We can't see the kidneys. We can't see anything with the function. So the only way we get a chance to see how things are going is to take a lab test. And so we look at both blood and urine to be able to figure out if your kidneys are working right. So there's a blood test called creatinine. And creatinine is a routine measurement to see how well the kidneys are filtering. And that creatinine then can be used to be able to tell us how good things are going. But we also look at your urine, and that's just a bugger, isn't it? Nobody likes to give a urine sample. But the reason is that if we see things like protein that show up in your urine, we also know we can prevent your kidneys from getting worse by using particular medicines. So that's why we ask for that one. Okay, so the big takeaways in the labs is what's the creatinine doing and what is there protein in the urine? Okay, so sometimes people might go to the hospital and they might have a pneumonia, or you might have diarrhea and you get dehydrated, and they might tell you you have an acute kidney injury. And what that means is that you have had a change in your kidney function that's happened because of something else. And that can be something that's usually treatable. And so when that happens, we just have to pay attention to it. Like this woman mentioned, sometimes we have to adjust your medicines a little bit. Sometimes we have to give you extra fluids. There's lots of things that we do to treat that, but often that gets better. But the more times that happens to somebody, the more likely it is that we have damage that's permanent. So we want to do our best job, as we all would know, of staying away from getting sick, not having complications with our medical issues, so we can avoid this from happening. But the thing that happens most often, and what we'll talk about for the rest of today, is chronic kidney disease. So this is when damage happens that's long-lasting. As opposed to the acute kidney injury that gets better, chronic kidney disease often doesn't. But we've made some strides in trying to prevent progression, and so we do have hope on the horizon. So the major causes of this: diabetes, high blood pressure. Sometimes there's genetic things like polycystic kidney disease, which is something that is common actually and runs in families, and that can cause chronic kidney disease. And sometimes it has to do with our urine flow. So often as men age, they have prostate issues and they can get a backup of urine into their kidneys and cause damage. So there's lots of things that we look for to try to figure out how do we prevent anything more from happening. And so we use that creatinine level to be able to calculate something called the glomerular filtration rate. Holy smokes, huh? It's called the GFR, and it's on every one of your lab reports. And when you look at that, that's a number that's calculated based on your age and it's in your sex. We do not put race in that anymore, which is a really good idea. And it gives you a number that's essentially the percentage of kidney function that you have. And I've put this little chart up here to tell you that, stage 1 is 90 or higher. Stage 2 is between 60 and 90, but most people fall in the stage 3, 4, and 5 category. And what we're trying to do is try to keep your kidney function stable. Remember, I told you most often you don't have any symptoms until you get towards the end of these stages. And so that usually doesn't happen until stage late 4 or 5. And so we have to do these lab tests for us to know that we got to make some changes, and we have to be able to see how things are progressing. And so this is something that's routinely measured, probably by your primary care doctor, or if you see a kidney doctor, it'll always be a part of that visit too. All right. And what I told you before is that protein matters. Having protein in your urine means that you're more likely to have progressive kidney disease. And so that's why we're looking for that and trying to change that. So when I show you this chart, all that I want you to see is on the left side, that's the stages that I just told you, the 1 through 5. And across the top is how much protein's in your urine, from very little to quite a lot. And you're at very high risk if you have low function and a lot of protein. You're at less risk if you don't. And so trying to keep us out of those ranges to keep your kidney function stable is really, really an important part. Okay. All right. So the first step in managing chronic kidney disease is thinking about the cause. And I told you that diabetes is one of the major causes for chronic kidney disease. And so, being able to control your blood sugars is the best treatment for the kidneys. So we try to get people to get to at least an A1C, that's a lab test to show us how well our sugars are controlled, to 7.5 or less. And what happens in diabetes is those big sugars that are in places they're not supposed to be because we have too much of it starts to go through and it wreaks havoc on those filters. You can think of it kind of like a coffee filter. And if we start putting these big pieces through, it makes holes happen and then lots of stuff fills through that shouldn't, and our kidney function starts to decline. So that's how diabetes is affecting the kidneys. And it's just really a huge number of people that are affected that way. But the good part is that by changing from uncontrolled diabetes to a place where you have better sugar control, we can halt that progression. We can really slow that down, which is good. The other thing that causes chronic kidney disease progression is hypertension. And so having high blood pressure and that continuous extra amount of pressure in those little blood vessels that I showed you at the beginning can start to cause them to scar. And as opposed to the heart, where we have a heart attack, the kidneys don't tell you that things are changing or that you're having pain or any of that sort of thing. Each filter just starts to scar and goes away, and then you have less and less to work with. And so that's how that happens in hypertension. So our goals here, we mentioned before with that great question, stop smoking so that we don't have increased amounts of high blood pressure. We try to get your blood pressure as low as 110 to 130. Can you believe that? So that would be ideal for that top number when you measure your blood pressure, and the bottom number in the 70s. And then, we try to think about your salt levels and how much salt you have in your diet. Okay, so those are the factors if you do have high blood pressure that you can do even if you don't have chronic kidney disease to prevent that from the future. Such a good question. Her question is, does everybody have the same goal for blood pressure? That is such a great question. We have actually found that people who fall within that range are better off no matter what kind of body type they have. Now, there is a caveat, which is why I put that little picture up there. We have to be able to measure our blood pressure accurately. So what I'll tell you is that we want you to be sitting down relaxing for at least 5 minutes before you check your blood pressure. We want you to have your back supported and your feet flat on the ground. And then we want your arm to be resting on a table or something that's about the same level as your heart. When you do that, that's how you most accurately can measure your blood pressure. Now, all of us have different sized arms. We've got the muscular arms, and we've got the little arms, and we've got everything in between. And so you have to have a cuff that's big enough to go around your arm. If it's too small, it won't be accurate. And those wrist ones, not so good. So I'm sorry if you have a wrist blood pressure cuff. It's better than nothing, but they're just not super accurate. And so that's the part that I worry about with those wrist cuffs. Okay? But one of the things that's kind of impressive is that's the easiest thing at home that you can do to watch and see that the kidneys are happy, because I told you kidneys control blood pressure. So when things start to go haywire with your kidneys, often we'll see a change in your blood pressure. It's not always related to the kidneys, but it's something that would signal to me that I'd want to look at things a little more closely. And when I mean monitor, it doesn't mean you have to do it 3 times a day. Okay? If you did it a couple of times, potentially a month, that could be enough, depending on what other kinds of things you have going on. Now, sometimes your doctors will tell you, we need you to measure it every day. And if that's the advice you've gotten, you should do that. But if you're not doing it at all, probably means that, every now and then all of us could benefit from having a little knowledge that we're falling in this right range. Look at all the homework I'm giving you, huh? All right. Now, we can slow the progression of kidney disease. Who has seen a kidney disease commercial on TV? Yes. Do you guys remember any of the names of medicines that they advertise? Well, if you've seen the people dancing, and if you've seen the turtles, those are usually the chronic kidney disease commercials these days. And so we'll talk about those. Kidney disease has not had a lot of new things happen in quite a long time. But in the last 5 years or so, we really have introduced some new medicines that have made our kidneys last an average of 9 years longer. That's impressive, isn't it? Now, that means usually that we're catching it on the early side to be able to have the biggest impact. But can you believe we can make that much of a difference just by changing your medicines? So the first ones, and you probably recognize some of these, one is called an ACE inhibitor or an angiotensin receptor blocker. And I just put a couple names up there because there's about 18 in each category, right? And those medicines are made to lower blood pressure, but they actually also work on reducing that protein in the urine. They also decrease inflammation. They're found to be good for your heart. So we found all these extra benefits of these medicines that are beyond just the blood pressure control. And so that has been an exciting part that's been around quite a long time. Okay, and so all of our basis of treatment of chronic kidney disease usually stems from starting with those medicines. Now, the way that those work is that they don't work very well in your kidneys if you're dehydrated. And so what she was sharing before, that some medicines can hurt the kidneys, well, if we have very low blood pressure and we're on these medicines, that doesn't work together. So there's another reason why we should keep monitoring our blood pressure to make sure it's not too high, but also not too low, because that can be problematic too. Yeah, she's sharing that there's a lot of monitoring that happens after a transplant happens. There's a part I'm so happy about that. Yeah, go ahead.
Transplant, another thing, we'll be on a lot of medication you gotta take.
Yeah, there is. There is. And she has a good big team that works to keep her transplant working. I just wish though that we would have a team like that we could have done it ahead of time. If we could have prevented that sure would have been nice.
You said there's no way to know.
Well, we can know if we do the screening.
Yes, you do.
Mm-hmm.
That's how my
So, anybody who's got a diagnosis of high blood pressure, if you've got a diagnosis of diabetes, that is something that makes us want to make sure we're monitoring to be sure the kidneys are still working well. And making sure we know that that's the case through those routine lab tests is a good important part. Okay? So the second set of medicines that I was going to share with you was one of the ones on the commercials. And so this one is called Jardiance. There's another one called Farxiga. And those are the dancing medicines. They're also the turtles. And so the turtle message is that they're slowing the progression of kidney disease. These medicines were actually developed to be diabetes medicines. And they panned out not to work so well as diabetes medicines. They only work a little bit as those. But what they found in the studies is that they worked really well with preventing progression of kidney disease and protecting the heart. And they don't even know really why. But fortunately, we were studying them in the diabetes population and finding this to be true. So then when we found that, we started studying people who didn't have diabetes, and they found the same thing. So you don't even need to have diabetes to take these medicines that were made for diabetes to get that same benefit. And so I just put that little very scientific graphic up there to be able to show you that top line is people having progression of their cardiovascular disease, and having difficulties with those events happened much more often if you were not on the medicine. And so it was protective to the heart, and then this one shows that it was protective to the kidneys as well. Okay? So it was really nice. Now the problem with these medicines is they're kind of expensive. If you are a veteran, they are available because of all the good data we have, and they're almost generic. So we are almost to a place where they're going to be more affordable for everyone. And so that's been the hiccup with getting these medicines to enough people. Okay. Oops. All right, so what I wanted to share with you is sort of the symptoms. So we talked about the fact that things are very, very quiet with the kidneys. So during those stages, and remember there's 5 stages, during those stages 1 through 4, we probably don't see a whole heck of a lot for symptoms. We might see some changes in blood pressure, which you guys are all gonna recognize now because I've made you have that assignment. You might see a little more swelling in your ankles. You might have some issues where you need a little more help getting rid of fluid. And sometimes your doctor will recognize some things like potassium issues or some issues with acids in your blood that build up, but not something that you feel. It's only when we get towards that stage 5 where definitely we start to see more swelling. People might get really itchy. They might have nausea and weight loss and start to feel really crappy. They have less mental acuity, so they start to be kind of confused, but maybe not even in a way that they recognize. And that's all because of those toxins that are building up that the kidney is usually getting rid of for us. And when that starts to happen, then we have to make some decisions about what's next. Yeah.
Are you talking about leg swelling or what?
Yeah, so what happens is, you don't get rid of the water in your body like you might at this point. And so you start to have more water and you've got to go somewhere. And gravity is not always our friend. And it always goes to the place where it's the lowest, and that's the feet usually. And so you'll start to have that problem where if you push on your legs, you're going to have a big dent. And sometimes we'll start to give you water pills to try to get rid of that. And this becomes an issue over time where sometimes we can't even do it with pills anymore. And so then we're at a place where we gotta take that water away in a different mechanism. So there's a few different options. And does anyone know anyone who's been on dialysis? Raise your hand if you know. Well, you all know her. But, dialysis is a full-time job, man. It is a lot of ask. And so even as a kidney doctor, my least favorite thing is when I have to start someone on dialysis. And so there's a few different kinds of dialysis, and so I share this with you, hopefully not because any of you will need it, but rather so you can understand what someone else is going through. So this is a man who is on dialysis. It's just a picture off the internet, but he is sitting there in a chair, and that machine is next to him. Those lines right there take his blood, and they filter it through a filter, and then go back into him after things have been cleaned. And in doing that, he sits there 3 days a week for 3 or 4 hours a time. And so you think about how much time that is. But, our kidneys right now are working 24/7. So we really have narrowed that down if it's only 4 hours 3 times a week. And so we're just getting by with cleaning by doing it this way. There's a lot of things that people go through apart from that schedule. It's also diet restrictions, limiting fluids, because we're trying our best to not have that machine have to do too much. So there's lots that goes into that. So there's another option. One of it's called peritoneal dialysis. And this is a dialysis that also cleans your blood, but it does it very creatively. It's a process where people take fluid and they put it into their bellies, around their bowels. It sits there for a couple of hours, and then it drains out, and the toxins come out with it. Put in more fluid, it drains out. And this process happens, hopefully, overnight. So people do it 6 or 7 times a week at nighttime while they sleep, if they can do it. And they're doing it at home. Exactly. Yep, exactly. And so this is one option that's a little different. It gives you more flexibility and a little less restrictions. Like she was mentioning, that first type of dialysis you can do at home too. You have to have a lot of support to be able to do that, as you do with each of these. And then the other option is to think about transplant. And so if a person is healthy enough, then they can qualify to be listed for a transplant. And I bet you didn't know that you're living in a city where there usually is the top 3 transplant centers in the country, and we're one of them. We do almost as many transplants here as anywhere in the country, which is amazing. And so there's a kidney transplant that happens about once a day in Wisconsin. And so I thank you for all of you who are donors, because that's an important part of this process. The people of Wisconsin have become, pretty high levels in donors, but also just, in that acceptance. And then the program that we built at UW is just really strong to be able to have that happen. So we also have one of the shortest wait lists in the country. And yet it's longer than I bet you think. So how long do you think it would take to get a kidney transplant? Okay. Well, the average wait time is 3 to 5 years. Yeah. Yeah, and they have to stay on dialysis until that happens. Yeah. So this process is really crazy. So there's lots of things that factor into that, like your blood type and different things like that. But, it really, you have to be healthy enough to have that. And a lot of people are not healthy enough to get that transplant. And so then they do dialysis for the rest of their life. I have a young man that I take care of in my dialysis unit who we celebrated his 25th dialysis anniversary this year. So it's crazy how long that can be for people. But I want to just highlight at the bottom, and it's not meant to say that it's less important, but, this is a choice. We all decide how we want to live our lives, and I want you to hear that that's true for every medical intervention. Nothing is something you have to do, right? As doctors, we sometimes forget to share that part. You get to choose to take the medicines that you do. We are supposed to just share with you the information about why it's good for you or why we think it would be helpful. You get to be the ones to decide what you're going to do. So some people choose to do dialysis. Some people don't. We all are going to pass away at some point in our lives, and some people choose that chronic kidney disease is the way that they are going to pass away. And so there's a good proportion of people who choose that. And by that, what that means is that we manage their symptoms and try to help them feel as good as they can until their time comes. And so that's also a really hard decision because we aren't programmed to ever make that, right? We're sort of programmed in our minds to always want to live longer. But I would say, that perspective, you should live better, not longer, right? And I think that that's a different way to look at things. Okay. So, what I want to share with you here is this is a graphic that is just a little bit confusing, but what it's showing you is the first bar is the general population and what the mortality rate is for people who don't have chronic kidney disease. And of course, we see it go up as people age. And so that's what that first line is on the front. Somebody with a transplant is the next one. Chronic kidney disease is the next one. And the back one is people on hemodialysis. And so that shows you that people who are requiring dialysis really have a high rate of passing away because of how much burden it is. And that's something I share with you not to scare you, but to show you how important prevention is. So if we can catch something early and we can use those medicines like I shared with you to prevent progression so you never have to go on dialysis or you don't need to have a transplant and those things, that would be the best mechanism that we can do. So, but we're grateful for transplants, aren't we? Because we move from that back line to that middle line, which is a great thing to have happen. Yeah. Good. So that's the material I was going to share with you today, but I'd love to take any questions that you might have about kidneys or other things that I can talk to you about. Oh, absolutely. Thank you. Yes, it is really important. She's sharing that how important it is to understand why we do things. And so I really encourage you to ask that question to the doctors when you are asked to do something. You know, I'm happy to do this thing, but why do I need it for, and what are you looking for? You can ask them that, because that's a totally valid question, and then it helps you know that, gosh, this is an important part, and I do want to do this. And that helps us have better communication both ways. So thanks for that comment. Yeah. Oh, I love that you asked that. So her question was, where does that protein that's in the urine come from? So we absorb protein when we eat food, and it doesn't have to just be meat. All different kinds of proteins are absorbed or produced in our body, and they were all meant to stay in our blood. And when we have filters that have holes in them, it filters through in a way that isn't supposed to happen and causes more of that protein to go in the urine. So eventually, if our bodies can't keep up with absorbing protein or making those proteins, we end up getting protein deficient in our bodies because we lose it through the urine. Now, that protein does not mean that if you eat a lot of protein, that could cause the protein in the urine. Those things don't go together. Unless you're deciding to be like some crazy bodybuilder eating like crazy amounts of protein. Once in a while we have that. But otherwise, it isn't related. It's really a marker of there being damage in the kidneys because it's handling the proteins inappropriately. Thanks for that question. So, no. So can I do that comment first? Okay, so she's asking about whether or not there's an age limit for transplants. And instead of an age limit, we've really evolved in looking at a frailty limit. And so if a person is quite frail and they're 60, they may be rejected. If they are actually active and going around the world in a great way, interacting and has a great high quality of life, then it could be as late as 80. The oldest one in my clinic who got a transplant was 83 when he got a transplant. And so what they're looking at is your life expectancy. Yeah. Kidneys don't always last forever. And they want to try to match up a kidney with how much time you have left on the earth. And so we want you to at least have 10 years of life left before they would give you a kidney. And that's how they kind of think about it. Okay, yeah. She's asking about the limitations as you age. And so there are still certain things that no matter the age they can take. So sometimes they'll still take skin or they'll take your cornea. Sometimes, if you think about it, we probably don't want to give an 18-year-old kid a 80-year-old kidney. And so because we do have some wear and tear that happens even if your kidney function is perfect, that happens over time. But we do actually extend our donors much longer than we used to because we hate throwing away good organs. And so it does depend a little bit on each situation and how many, comorbidities you have. Do you have high blood pressure? Has diabetes been a part of your life? Those kinds of things will play into it. Yeah, so just, and your driver's license is the most important part, just to say that. But then in your living will, it's always great to just list that stuff out as to what your preferences are, and then they'll tell you, or they'll tell your family at the time if there are things that they can take and things that they cannot. Yeah. Good. He's asking about kidney stones, and I didn't even get to that. There's so much more. Okay, so kidney stones come in two forms. One of them comes in a form where you are a person who's not very good at hydration. And that's the most common cause of kidney stones. We don't push the fluid through enough, and so the little stuff starts to precipitate and causes a stone to form. So a good amount of fluid is something that is needed to prevent kidney stones. But it's interesting because some people are just more prone to them than others. I've never formed a stone. I sometimes don't drink enough, and so I'm lucky. But not everybody is that. The second form is a genetic form. So the way we handle different substances can vary in your family, and some people have genetic reasons why kidney stones form. And I should just use the caveat, there's also diet things that can influence kidney stones. And what I want you to hear is, if you have kidney stones, it doesn't mean avoid calcium. Sometimes people hear that. That's not true. And so, definitely talking about risks and benefits. A healthy diet with lots of fruits and vegetables is good for preventing kidney stones. Yeah.
you mentioned about too much.
Yeah, she's asking about how much ibuprofen can I actually take. That's going to vary by each person. If you have chronic kidney disease, we're going to tell you that it's always risky. If you don't have chronic kidney disease, what I will tell you is that the more doses you take, the more risky it is, and the more dehydrated you are when you take them, the more risky it is. So if you decide to take a dose of the water, of the anti-inflammatories, then you should think of, I need to drink more water today. If you're on a situation where you're on a water pill, it may be a day that you could skip your water pill depending on what it is that you're doing in your life. Those kinds of things factor into that, and so they're kind of a risky medicine. Now, if you have perfect kidneys and it's gone well and you talk with your doctor about it, I want you to have quality of life too. And sometimes we choose those trade-offs knowing the risks just because of the fact that it's the only way you can get around. So I actually never tell people they can't. I just tell them, here's the risks you're putting yourself in. And I've had people choose to continue to take them enough to end up on dialysis. So he's asking if you'd want the GFR to go down. I think that's probably a little confusing because we want creatinine to go down, which allows GFR to go up, and that's all just in the calculation. So I can't think of a reason why I'd ever want it to go down. The only thing is that some of the medicines, even though they're protective, can cause that number to go down a little bit, despite us wanting you to be on them. And so if they said, we're going to start this medicine and you can expect to see a little decline in your kidney function as a side effect, that's true. That's normal. That happens to people. So that's one of the things. There was a second part. What was the second part?
Renal, what about renal?
Oh, yeah. Okay, so most people who have chronic kidney disease don't see a kidney doctor if it's mild. People who have a GFR usually less than 40 to 45 see kidney doctors. If you have a lot of protein that the primary care doctor can't control, then they see kidney doctors. Or if we can't figure out why you have kidney disease, that's often why you see kidney doctors. So that's the three things I tell primary care doctors, why I want you to send people to me. Yeah, that's a great question. So she's asking about urination and how that relates to kidney function. So often the frequency or issues with actually passing urine has more to do with the bladder than it does with the kidneys. So the kidneys make the urine, and then the bladder will hold it, and then that whole mechanism to get rid of it, there's so many things that can affect it. It's crazy how much we are excited about trying to prevent urine until you have a place where your kidneys don't work anymore and you don't have any urine, and then everyone wants to pee again. So it's pretty crazy how this goes. Now, are those the copies? Okay. So I have to share with you, I told my daughter, who's 16, that I was coming here to do this talk, and she said, oh, can I make a handout? And so she put this together, and I had to edit it very little. She looked up all of this stuff on the internet, and then she used AI a little bit, and so she created this little handout for you to take with you about health and chronic kidney disease. So this one edited by me, but made by my daughter.
Thank you for us.
I will.